Good morning to our viewers and listeners. Welcome to the Regional Dialogue here at the Government Information Center. Today we are coming you live from Otjozondjupa. We are going to discuss about a very important event, the 2025 World AIDS Day Commemoration, set to take place on the 5th of December 2025. The commemoration will be commemorated under the theme Sustaining HIV Response, Ending Stigma, and Building Resilient Communities, and will be commemorated here in Otjozondjupa, the capital of Otjozondjupa Region. Joining us today is the Director of Health from the Ministry of Health and Social Services, Mr. Gebhardo Timoteus, and Ms.Welma Guriras, the Director of Planning and Development from the Otjozondjupa Regional Council. I'm your host, Elago Shipanga. Good morning to you all and welcome to the Government Information Center.
Good morning, Mr. Lago.
Good morning, Mr. Lago, and good morning, Namibia.
Yes, the World AIDS Day Commemoration. Perhaps, Mr. Timotheus, can you briefly explain to us what this celebration means for Namibia and why do we need to commemorate it?
Yeah, the commemoration of World AIDS Day, what it means for Namibia is that we are reflecting on the government's commitment in terms of the achievement we have done so far, and especially in responding to HIV/AIDS. The impact, positive impact, especially when you look currently, Namibia is ranked among globally, is ranked among the countries that are doing very well, due to the fact that our people who are on ART, our coverage is very high. The suppression of the viral load currently is very high. Our PMTC program is working very well. And then if you also look at the AIDS-related death in the country, it's highly reduced. Now, while we are celebrating or we are commemorating the World AIDS Day, we also have to remember our people, our loved ones who have left us due to HIV-related death. At the same time, we need to celebrate the resilience of our people who are currently living with HIV. And then above all, we have to acknowledge and appreciate the efforts and the hard work done by and continue to be done by our healthcare workers, our communities, our stakeholders, our partners that are assisting us to fight HIV. So therefore, it's very important for all of us to join hands to come to Otjozondjupa and celebrate, reflect, and also commemorate this important day.
Indeed. You just mentioned that we are doing well. We have a high coverage of those who are on treatment. The PMCT program is active. Perhaps what are other achievements can you highlight for us today?
The other achievement what I would like to highlight is also that the Ministry of Health and Social Services or the Government of the Republic of Namibia have decentralized services, including the HIV services, to the primary healthcare levels, up down to the communities. This we have done it through our outreach program, through our community healthcare workers, through engagement of our community, through our community leaders, our political leaders, our faith-based leaders, and many other support groups and support teams that are within our communities. That is a very great achievement.
Indeed. Ms. Guriras, how does it feel for Otjozondjupa to be selected to host this year's World AIDS Day commemoration?
Thank you very much, Lako. Good morning, viewers. The hosting of 2025 World AIDS Day commemoration was among the cluster regions of Erongo, Kunene, and Otjozondjupa. One region was ought to be selected to host the event. So on that note, Otjozondjupa was selected because there is still a public health concern about the HIV prevalence rate, which is exceeding 13% in the region in the age groups of 15 to 49. And mostly this is affecting females than males in all 5 districts. So for Otjozondjupa to host this event, it is indeed an honor and a responsibility, looking at the challenges that we are facing, as well as on the progress. Hosting this event will create more awareness in the region, and we will also contribute to the national achievement of prevalence reduction in prevalence rate for the country. Thank you very much.
Okay, no, thank you so much for highlighting that important message, which is for us to tackle this high rate of prevalence rate when it comes to HIV and AIDS. Mr. Timoteus, this year's theme touches on sustainability, ending stigma, and building resilient communities. Why was this theme chosen, and how does it align to the national's HIV and AIDS prevention or response strategy?
Yeah, yes, of course, I think it's a good thing. And what it means and why it was, why it's important to us as a country and also as a region is that when it comes to sustainability, we talk about the government commitment to make sure that there is reliable financing to fund the HIV/AIDS program. There are systems that are in place to make sure that our people who need HIV/AIDS related treatment services and care, they are receiving it. And then, above all, we are also looking at the issue of stigma, as you mentioned, to end stigma. Because stigma in itself is a barrier. Stigma and discrimination is a barrier to our people to access treatment. Let me start first and foremost, to go for testing, to disclose their HIV status, to be initiated on treatment, and to be adhering to their treatment. Just because of stigma, there is a stumbling block. And as Namibia, as a country, our country has a constitution which stipulating clear that no form of discrimination should be allowed. Therefore, as we are commemorating this day, we need to reflect and make sure that we should not discriminate our people, no matter about their HIV status or any other, whether illnesses. We should make sure that we support them, they receive the treatment they need, they receive the treatment, the services they need. So when it comes to building resilience, we are talking about our communities. Communities are informed, communities are engaged, communities are involved, communities are taking ownership, and they take a lead to make sure that the healthcare services, not only the HIV-related services, but all healthcare services, have reached each and every individual who is in need. And this cannot only be now, it should be also in case when we are facing challenges, even crisis. I remember very well when we were having COVID-19 epidemic. Our Ministry of Health and Social Services and other ministries and other stakeholders, we join hands and we make sure while we are responding and combating COVID-19, no services pertaining to health was compromised, including HIV-related services. Our people have received services as usual. And therefore, that's what I would like to see to continue engaging, involving, and participating.
Thank you indeed. When it comes to community-led response in the sustenance of HIV response, how can we define that?
Community-led response is self-explanatory. It simply means that the communities are participating. Communities are taking leadership. They organize themselves, whether it's in groups, whether it's in organizations. They take a lead and make sure that each and every individual within the community is taken care of. Not only necessarily about HIV/AIDS, as I mentioned, is an issue across the board, whether it's poverty reduction, whether it's a fight against TB, malaria, you mentioned them. What we are doing in the Ministry of Health and Social Services, we have embarked on a program to refresh and retrain our healthcare workers so that they are empowered with information and knowledge and skills, to train our community, to make sure that our communities are involved. We are also reaching out to our communities through our outreach program and making sure that our communities are involved, take ownership, so that when we are not there by that time that because we cannot be every day within the community, they are taking leadership and they are communicating back to us. And the community themselves, they know where to access services and information. So here we are doing it through our community leaders, our faith-based organization leaders, even our political leaders. We are engaging them. And we are so happy that most of our community, if not all of them, they are participating and they are taking a lead.
No, thank you for that. Earlier, you touched on stigma and discrimination. How big of is it a problem in Namibia, in hindering Namibia's efforts to ending HIV by 2030?
It's a very serious problem because, as I said, first and foremost, because of stigma and discrimination, our people are not accessing the testing, just the testing itself. And I want to highlight here, especially, we are even facing a challenge on men. We are facing a challenge to have men accessing our services. They are not coming forth. The youth are not coming forth. We are having which we call individuals, we call key populations. They are not accessing. And I believe this is purely, or let me say, stigma and discrimination is also a factor. It's adding to this. So therefore, when you are having our young people not accessing this because of stigma, they are afraid to be discriminated. And we are having men who are not accessing because they are fear to be discriminated. Key population are not coming forth. Obviously, the transmission of HIV is likely to happen in our community because these are people who are having loved ones, who are having partners, and who are having boyfriends and girlfriends and wives and husbands. It's very, very important that we reduce stigma at all levels.
No, thank you so much. Ms. Guriras, with limited funding, multi-sectoral collaboration becomes key in the prevention of HIV and AIDS. How does the Regional Council, through its coordinating committee, make sure that coordination happens when it comes to HIV and AIDS prevention?
Okay, when we talk about limited funding, involving all sectors, whether it's private or public sector, it helps to coordinate resources, cost-sharing and resource leveraging. We generally believe that HIV/AIDS is a health issue, whereas it is not. It affects gender, it affects equality, inequality, it affects education, social welfare services. So that's why it is important for a multi-sectoral approach for us to root out these ills that we are finding that are contributing to increased prevalence rates. Now, as a regional council, we have these coordinating structures where we are talking about the constituency HIV/AIDS coordinating committee that is at the constituency level, at the grassroots level. And then we have the regional HIV/AIDS coordinating committee, which is at the regional level. And in these committees at all levels, we have all sectors involved, whether it's private, whether it's traditional leaders, whether it's faith-based organizations, or entities that are dealing with health issues. So basically, these committees are there to advocate in terms of prevention to the communities and as well as the adherence. We cannot just talk about prevention. We must also put a big emphasis on adherence, because people can start taking ARV drugs and then they will be defaulting. So we must also preach in terms of adherence. So this multi-sectoral approach is very important so that all of us can be involved to fight against HIV/AIDS. Thank you very much.
No, thank you. So it's not only the responsibility of the Ministry of Health and Social Services to make sure that we prevent and continue spreading the message, but it's our responsibility, everybody else.
Yes.
No, thank you for that. Mr. Director, the concept note of this year's commemoration talks about the importance of mental health and wellness as part of the HIV/AIDS response. How is the region integrating this into its ongoing health initiatives?
Yes, the region have already started integrating mental health in all our services, not necessarily only on HIV/AIDS program, but in all our services. Mental health is a real issue, and it's a big issue. Big issue because it really affecting families, starting from individuals, families, communities, and a country. Now, what we have done so far, we have already embarked upon a program, a training program, a refresher training for our healthcare workers, so that we train them how to integrate mental health into all our services. We are also in the process of making sure that we decentralize from the regional capital to all our districts. These services of mental health should be accessed. We must be able to make sure that each and every individual coming to our healthcare services, we share information about mental health, and we also create linkages, referral linkages, so that our people can access to psychosocial support. We also make sure that our institutions, health facilities, are equipped with knowledgeable and skillful human resource professionals that are able to address issues of mental health. And also, we empower our communities to educate them so that they be able to identify earlier the signs and symptoms of mental illness within their communities, and also to know where to refer these individuals. So, of course, it's not a walk in the park, but I have trust that the Ministry of Health and Social Services and the government at large, they are supporting us.
Okay. No, thank you so much for that. If you just joined us, you are watching the Government Information Center, where we are dealing with the regional dialogue, focusing on the 2025 World AIDS Day Commemoration. The commemoration is set to take place on the 5th of December here in Otjozondjupa. Mr. Director, looking at the targets, how is Namibia doing in terms of the UNAIDS fast-track target of towards ending HIV by 2030?
Namibia is doing very well. As I mentioned earlier, the 95, we are already there. What we need to do is now just to be resilient enough. We have to combine efforts. My counterpart have already mentioned that the HIV response is not only necessarily for Ministry of Health and Social Services or Regional Council. It's all of us, being individuals, being organizations, companies, non-governmental organizations. We need to combine efforts so that our plan to end AIDS by 2030 become a reality. Let's put our effort together. Let's combine resources. Let's share information. Let's involve our people. Let's engage our communities so that we make a way through. Thank you very much.
No, thank you so for that. And indeed, it's a great news that we have reached these targets. And to echo to your message of let's not relax. And I saw that the ministry have now set itself to reach 98%. So that's a good sign. Ms. Guriras, Otjozondjupa continue to face serial health challenges when it comes to HIV prevalence rate among adults, and it's over 13%. From a development planning perspective, how do these numbers affect the region's overall growth and socio-economic development?
Thank you very much, Alako. As you have rightly mentioned, the high HIV prevalence rates really have an impact on the socio-economic development of the region. Because here we are talking about human capital, which is our resources. We are also talking about low productivity. Now, when we talk about human capital, we have said the age range is between 15 and 49 age range, the affected age group. Now, we will have issues of people being absent from work. In terms of productivity, we'll have low productivity. People will be absent from work either to take care of their sick relatives or either they themselves will be sick. Now, knowing Otjozondjupa is an agricultural region where we have crop production as well as livestock. Now, livestock, in terms of livestock, we in agriculture will also have low productivity. And informal sector also will have losses of capable resources, which are human capital. The other issue will also be reduced in terms of household income. We will be sitting with child-headed households, which will put pressure on the already strained social welfare of the government and also the community safety nets. Because we'll have overseas now that will be registered to get funding because they are no more of our parents. Now, those are the social economic impact that this HIV/AIDS will have on the region. Now, it will put a constraint on the human capital, on the productivity. So as a region, we must come up with effective strategies. How can we, as I've said, there is a multi-sectoral approach in terms of HIV/AIDS. All of us come on board, set up strategies, how we can effectively root out these ills or how we can minimize, even if we don't root out these ills, at least to minimize so that in terms of poverty, we can increase, because that is also one of the root causes of the infection, because a person that is not having any employment or anything can go out and get involved in other activities that will lead to infection. Thank you very much.
No, thank you for highlighting those challenges. And as you said, it will become a burden to government, especially in providing for these OVCs, which now have a ripple effect on the capital development. For instance, in terms of putting a school or a clinic, now we have to divert these funds to social services. Now, Mr. Timoteus, according to the recent statistics, Otjozondjupa's the districts mainly, Chivarongo, Okakarara, and Grootfontein, have a higher HIV prevalence rate. Perhaps what are some of the drivers that we find this higher number of new infections in these districts?
The drivers of the higher rate of HIV in those towns that you mentioned, they are not new. These are the drivers that we all of us know and are aware. One of them is unprotected sex. The multiple concurrent partners, the the intergenerational relationships, alcohol abuse, and then also the poverty, which my counterpart just mentioned now. You know, poverty and unemployment goes together. And we are all aware that Otjozondjupa is at the center. When we look at these main roads that are transporting goods and services, either from South Africa through the B1, or from our port of Walvis Bay, or from Transkarahari through Hobabes, coming through Grootfontein. So actually, if I may use the word, we are actually a hotspot, because our people who are poor, people who are vulnerable, unemployed, they are likely to engage in unprotected sex with these truck drivers. And mind you, these people of us, which we are referring to, they are having partners, they are having boyfriends and girlfriends, they are having husband and wives, if I may say. And that is how the transmissions of HIV spread. So what we need to do as a region, first and foremost, we need to educate our communities. We need to involve our communities. We need to make services available. We have to make resources available in terms of condoms and empower our communities, whether it's with information to make sure that they are aware how they can protect themselves through abstainment, through sticking to one partner, not to engage in multiple in the generational sex, and also to make sure that our people are taken care of in terms of how to reduce poverty. Programs and projects in the community, as my counterpart, is not only the responsibility of government, it's for all of us. Let us join hands and fight poverty, because it's also one of the contributing factors. Thank you.
No, thank you so much. Perhaps what are some of the activities the region is doing to address these vulnerable groups? We're now talking about young people, rural communities, and this key population. We talk of people, we are looking at in towns where these transit trucks are passing through.
As a ministry and as a region, we have already started engaging our youth. We have youth groups that we are engaging at the primary healthcare level, in the community levels. We also having specialized organizations that are dealing with key populations, spreading messages, and also empowering these groups to enable them to protect themselves and protect their loved ones. So it's not an easy task, as I mentioned already earlier, that it needs concerted effort. The ministry alone will not be able. Therefore, we have been and continue calling our stakeholders to assist us, especially to reach out to the youth and key population. It's very, very critical that we join effort. But I can confidently say we are doing a lot, and we are already observing some impacts. And we are likely, if we continue in the same trend or improve even, we are likely to see coming the next financial year, when you do statistics, we are optimistic that there will be a change, a positive change.
No, thank you for that. Now, South Africa has approved a twice-a-year injection for HIV prevention, which is they expect to launch in March 2026. Is our Ministry of Health perhaps looking into the same to put this type of prevention method in its health protocols?
Yeah. On my own perspective, I see it as a good initiative, provided that it's effective and it's sustainable. And it's not for me actually to comment on that. I leave it on the honors. I leave to the Honorable Minister and the Executive Director to comment on that. But I think it's a good lesson for us to learn. Let us observe and see, and then perhaps emulate going forward.
Indeed. Ms. Guriras, could you take us through, when it comes to the logistic of the day, what are the preparations so far, and what can the public expect come the 5th of December?
Preparation so far is going very well from the national as well as the regional level. The commemoration will take place at MICT Stadium, which is in Orodoveni, a very central location for everyone to attend, especially the inhabitants of Otjivarongo as well as from the region, and also the guests that will be coming from outside Otjozondjupa. There will be official statements, testimonies of people who are infected or affected. There will be cultural performances. There is a well-known musician who will perform. So we are especially urging the youth to attend. And cultural performances will also take place. There will be screening services provided by Ministry of Health and Social Services, which will be testing of HIV/AIDS, TB, your glucose levels in terms of diabetics. And there will also be wellness activities for the public at large. So we are urging everyone to join us on the 5th of December at MICT Stadium in Otjivarongo to commemorate World AIDS Day 2025. Thank you.
Oh, no, thank you. So it's not just going to be a day of messages, but health services will also be provided during the day.
Sure.
Okay, thank you. Now, we know Otjozondjupa is big. What are arrangements in place to make sure that all the inhabitants who would want to come to Otjivarongo and commemorate this day and listen to this important message make it to MICT Stadium?
Okay, thank you very much in terms of that. In terms of transport arrangements, we have liaised with Ministry of Works, Government Garage, and also various other people who are providing transport services, especially like schools who have buses. In terms of getting transport from Government Garage is a little bit of a challenge because they are faced with breakdowns of their buses, but we are still optimistic that we will secure some transport to ferry community members from outside Otjivarongo, everybody in the region. We have also asked for the help from the local authorities, various local authorities, to assist us in terms of this. So we are very much optimistic that our people from the region will join the activities on the 5th of December.
No, thank you. Perhaps on the last, what message do you want to send to the residents of Otjozondjupa and Namibia at large ahead of the World AIDS Day commemoration?
The message that I will send to Namibia is, I always believe we all are positive unless tested otherwise. Because if you are not tested, you cannot presume that you are negative. So let's go for testing. Let's adhere, let's prevent, and take care of ourselves because our health is our wealth. So Namibia, let's prevent. Thank you very much.
Thank you indeed for that very powerful message. Mr. Director, what are the biggest challenge currently facing the regional HIV response, and how can communities come in to help or to strengthen these responses?
Yeah, currently the challenges that we are facing is basically the one I've alluded to. One of them is stigma and discrimination that I have already mentioned that it's a barrier to our people to access, first just to go for testing and access and then remain on treatment, viral suppression. And then what I want the community or our community to do is let us be involved. When our teams are coming to your village, when our teams are coming to your settlement, to your town, go there and listen, participate, get involved, take the message to your loved ones, take your message to your neighbor, to your community, so that our concerted effort should bear results. We want to prevent and we want to treat those that are infected, and we want to suppress the viral load so that we minimize, if not totally preventing, the transmission of HIV, so that we end AIDS by 2030.
No, thank you. Perhaps your final thoughts. What outcome do you hope this year's commemoration will leave for Otjozondjupa residents and the Namibians as a whole?
I believe commemorating World AIDS Day in Otjiwarongo, Mokati Stadium, come the 5th of December, it will leave a message to all of us in Namibia that the government of the Republic of Namibia, through the Ministry of Health and Social Services, is committed to make sure that our people receive the necessary services, especially healthcare services, not only HIV, but all the services that the government of the Republic of Namibia have promised through the Ministry of Health and Social Services. Therefore, I invite all of you, come one, come all, so that you witness yourself how the government of the Republic of Namibia, through the Ministry of Services, Health and Social Services, are doing it, and they are going to continue doing so to protect the lives of our people and to maintain the health status of our people. Thank you very much.
No, thank you so much, Mr. Timoteus and Ms. Guriras, for joining us today and sharing the insight on this very important day that we are going to commemorate on the 5th of December. Oh, thank you.
Thank you very much.
To our viewers and listeners, thank you for joining in. We encourage all the residents of Otjozondjupa and the whole country at large, if you are able to make your way to Otjiwarongo, come, let's stand together under the theme Sustaining the HIV Response, Ending Stigma, and Building Resilient Communities. The commemoration aims to amplify the messages around prevention, testing, and treatment. Thank you for tuning in. From me and the entire crew of the GIC, together we can make a difference.